I realize that not only am I speaking at the tail end of a 4-day conference, but I'm also standing between you and lunch. So I'm going to run through these slides fairly fast. I think a lot of what I'll be talking about today, it has been discussed a bit this morning already. As Bob mentioned, I am the health policy advisor in Governor John HICKENLOOPE'S office in Colorado. In that capacity, I work with all of our state agencies that touch health and then really serve as a liaison to the community and to legislators in Colorado for all of our health-related policies. And to provide a little bit of context about Governor Hickenlooper and kind of his vision for health, if you're not familiar, John Hickenlooper is an entrepreneur, small business entrepreneur by background. He was actually trained as a geologist, which is how he ended up in Colorado, but was laid off and decided to start a brewery. And that brewery is one of kind of the anchors of a redevelopment in downtown Denver. And then he was, after about 10 years in that business, he was talked into running for Denver mayor, served as mayor for about 6 years, and then ran for governor. So he is a truly entrepreneurial spirit at heart. And as a result, a lot of our initiatives are really built around how we can work to collaborate in a multi-sector sort of way. So in terms of our health policy, we really see health as kind of a three-legged stool. We need healthy people, healthy education systems, and healthy businesses to make Colorado a great state. And our ultimate aim is to make Colorado the healthiest state in the nation. Part of our framework for achieving that is to have winnable battles. So there are 10 winnable battles that our public health department has identified as areas in which we can make significant progress in a fairly short amount of time. And then as an administration, we selected 3 of those winnable battles to really make a concerted effort on across agencies in Colorado. And those are obesity, oral health, and mental health and substance abuse. And diabetes education and diabetes, tackling the diabetes epidemic is really part of our obesity efforts. And I'll talk about that in a little bit. So just a little bit more specific detail on the challenges we face in Colorado. We are often championed as the leanest state in the country. We do have the lowest obesity prevalence. However, our obesity rate is growing just as fast as everyone else's. And so we're at 22% as of 2011. But if we wound the clock back just 20 years, this 22% that now makes us the leanest state in the nation would have ranked us as the heaviest state in the nation 20 years ago. So we're growing just as fast as everyone else, and we have a significant problem with obesity and diabetes. As you can see, 1 in 16 Coloradans has diabetes, and 1 in 3 are pre-diabetic. And then I threw some insurance figures here because one of the strategies I'm going to talk about a little bit is how to operationalize reimbursement. And part of the challenge in Colorado is that we have about 18% of our population that are uninsured. And our insurance market generally, we, unlike some states, particularly in the northeast part of the country, we have a very spread out insurance coverage market. So we have actually over 300 active insurers in Colorado, although most of our coverage, our private insurance coverage, is concentrated to the top 5 to 7 major insurers. And then we have 650,000 clients in Medicaid as well. And so in terms of our efforts to combat obesity and diabetes, our primary focus is to build a culture of healthy eating and active living. And we really try to do that not only across agencies, but then working with our private health partners and our insurers and employers to foster that at schools and in work sites and in communities through our built environment. So one example that's tangential, I think, to the diabetes conversation is last year we passed legislation banning trans fats from schools, just a way to get healthier food into the school environments. And we have a number of pieces. You know, physical activity we talked about a little bit earlier today as well. We do have physical activity standards, and although there's been some push to do a more rigorous physical education requirement in our schools, we face a lot of pushback from school districts who really don't see that as something that's available to them because of limited funding. And then part of all of our legislative and regulatory goals in this area are also tied to aligning insurance reimbursements with the goals that we have. So ensuring that any of the United States Preventive Services Task Force, USPSTF, all of their recommendations are available to be reimbursed by insurance companies. And our insurance agencies in Colorado really are some of our strongest partners in these efforts. And then focusing on evidence-based lifestyle prevention programs, and particularly those that have a demonstrable return on investment. And so I'll skip now and talk a little bit about NDPP, the National Diabetes Prevention Program, which Marty talked about very first thing this morning. But just kind of as a reminder, this is an evidence-based intervention program that is designed to prevent the onset of diabetes. And so it's targeted at people who are identified as having prediabetes, so that their blood sugar is too high, but not higher than normal, but not high enough that they are actually actively with diabetes. And then the program itself is a 16-week lifestyle intervention program. So the classes are about an hour to 2 hours per week, and they meet over the course of these 6 weeks. And this also kind of piggybacks on a question that we had earlier. The way we see this program is really building personal responsibility. You know, as Bob mentioned this morning, it's hard to take a couch potato culture and make it active. But what you can do is if you have individuals who are screened and identified as having prediabetes, to put them into a program, incentivize them to really join a program that helps them get the tools that they need to manage their condition and prevent diabetes. We can save costs down the line. The NDPP is one of the unique things about it is it's facilitated by community organizations and not by medical personnel. Certified diabetes educators, so people who specialize in this type of training are typically used, but the programs themselves are centered in nonprofit organizations typically. We also have some insurers that have programs that they facilitate themselves. And as Marty mentioned, the goal ultimately is 150 minutes of weekly physical activity, which will help people lose 5 to 7% of their body weight. And if they achieve these goals over the course of a year or 2 or 3, we can reduce the risk of going into full-blown diabetes by about 58%, which is huge. And then the kind of results of the study that Marty discussed this morning is that the potential for this program over the next 25 years would be to prevent or delay almost 900,000 cases of diabetes and save $5.7 billion in costs. And just one additional note on the National Diabetes Prevention Program. The studies that have been done to date are largely focused on the adult population, and so our efforts in Colorado really center on adults. But we see them as complementary to the efforts that we have in schools to ensure that our school communities are safe and that we're combating obesity in particular in schools. So this is a little just kind of flow diagram, and I imagine that most of you can't read it, but and I think we really walked through most of this in Marty's presentation. But so much of the National Diabetes Prevention Program is really due to significant federal backing and I'll say national backing through the American Diabetes Association and other national organizations that really do focus on this area. And so for Colorado, in relation to our National Diabetes Prevention Program, our goal is that we can make it accessible to all Coloradans by 2017 and reimbursable. And so getting into the details a little bit more, our real 3 core focus points are reimbursement, participant identification and referral, so getting them into the pipeline, and then delivering the program. And so we have a lot of partnerships that help us kind of build pipelines of organizations that will provide the program, identifying patients that will that need to be in the program and connecting them to those services, and then ultimately on the back end making sure that the cost for these programs is largely not coming out of individuals' pockets, but that it's covered by their reimbursement, or excuse me, covered by their insurance. And then just a small note on our program operations. We have a multi-sector advisory group that consists of about 15 organizations representing employers, insurers, nonprofit organizations, and a number of agencies within Colorado state government, and they meet monthly. And then from a state perspective, we do have 2 program staff, and I left the annual budget number blank because it's highly variable, but we are funded significantly through the CDC funding that Marty mentioned earlier today that does the diabetes prevention and control program. I'm going to just kind of skip this slide, but it really kind of shows how we move stepwise from where we are today to 2017. And here's a better overview. So our program, although our goal is to reach all Coloradans in a 5-year horizon, we have 3 kind of core focal components. The first is to target state employees, and that would be the orange band up there, which is our Department of Public Health and Environment. And we have a pilot program to really demonstrate local results in Colorado. So it provides the National Diabetes Prevention Program to state employees who are identified as having prediabetes through Kaiser, which happens to be one of our state employee health insurance options, but they facilitate the program on site for our Department of Public Health, which has about 1,300 employees. And then the blue band is really how our plan to expand that pilot program beyond just the Department of Public Health, but to make it available to all state employees all across the state. And then finally, the CDPHE NDPP statewide program is really how we operationalize this for all Coloradans, not just state employees. Although it's important, I think, for us to reach state employees first, A, because it is where we spend state dollars in healthcare, but also because we are the largest employer in the state. We have 32,000 employees. So just kind of to wrap up, I think the core of what we do is really dependent on our partnerships. And so we have partnerships at the national, community, and local level that really make this functional. And so at the national level, really kind of in the center bullet here, the Diabetes Prevention and Control Alliance, United Healthcare was one of the first partners to really come out with a diabetes program, and they have done so over time, kind of fused it with a partnership with the YMCA. And so that partnership itself has really provided a model for which in which we think Colorado can work, because United is committed to the reimbursement. They also provide a technology platform that facilitates the reimbursement. One of the key challenges is that community organizations that facilitate this program, like the YMCA, aren't doctor's offices. They don't have contracts with insurance companies typically. And so United's technology platform really enables community organizations to get reimbursed for the services they're providing. And last, the National Governors Association has done a comprehensive year-long learning collaborative with about 7 states that was focused on chronic disease. And each state got to select what chronic disease they wanted to focus on. But I think of the 7 states, 3 of us chose diabetes. And so we've really got to learn from those other states around what they're doing. And then moving in to our state government partnerships, because this is built into our obesity winnable battle, it really is a core component of our administration's #1 public health priority. And that has been huge in terms of where we can spend time, spend some resources to really move these efforts down the road further. And it allows us to really prioritize interdepartmental collaboration, not just with our public health department, but also with our Medicaid and public employee agencies. And then in that partnership, we work a lot with between our public health and our Medicaid agency to figure out the reimbursement options. There are a lot of challenges with reimbursing for this particular service for Medicaid. But I think that the core challenge, the one that's really ultimately fundamental, is that our Medicaid agency, with many other Medicaid agencies across the country, is really focused on trying to move out of a fee-for-service reimbursement and to provide more managed care is a bad word, but accountable care is what we call it these days. And so to provide more accountable care where the people that are managing an individual's care are really fundamentally accountable for population health. And so how can we build programs like this that are evidence-based and do demonstrate a very solid ROI? How can we build that into their incentives from a accountable care perspective rather than a fee-for-service in a fee-for-service system? It's just fundamentally challenging to do, but we're working on it. And then in Colorado, we do have Medicaid funding for diabetes self-management education, and so trying to use that as a platform on which we can expand that kind of program to reach the NDPP services that are provided. And then I discussed the pilot project with state employees already. And then finally, just to wrap up, our community collaboration around this is huge. Our advisory group that meets every month has a lot of people at the table. And I think it is the single core factor that has enabled us to be successful. In less than a year of this project operating, we actually formally just kicked it off in March, we have been able to really move down the road in terms of developing very strong community support for the initiatives that we're doing. We have buy-in from insurers and employers, and we work very closely with the nonprofit organizations that are ultimately going to deliver the service to individuals. And I should mention kind of our other key partnerships. Both Kaiser and United are in the top 5 of our insurance market. They are at the table every single month. They are both very committed to providing the National Diabetes Prevention Program. And so they have served really as leaders among their peers in figuring out how to operationalize this reimbursement for community-based organizations providing this program and this service. And we also have a strong YMCA presence in the Denver metro area. And because the YMCA of America has done diabetes prevention efforts for quite some time, our YMCAs will be launching National Diabetes Prevention Program reimbursed by United in 2013. So with that, I think we'll kind of move to questions, and I'll turn it back over to Bob. Thank you very much.